Thank you all, and good morning to everybody from the West Coast. And thank you for being here on your lunch break for everybody more on the East Coast time. We are really glad that you are able to join us today. I am Dr. Alana Goldberg, and I run the small business programs at NIBIB. And with me today is my colleague, Dr. Louisa Russell, and she is in charge of our biomaterial interfaces portfolio, which she will describe in detail a little later on. For this panel, we are going to have the question and answer box open. Please feel free to put all your questions into our question box, and we will respond to them in real time at the end of our presentation. So now I will pass it on to Dr. Russell to give a quick overview of NIH and our disclosure for everyone.
Thanks, Alana. So yeah, just to make sure everyone is on the same page before we really dive into SBIR and STTR specific concerns, we really wanted to make sure that everyone had a good understanding of the NIH overall. Next slide, please. Okay, so the National Institutes of Health, or the NIH, is a part of the larger Department of Health and Human Services, and it's really a research-focused institute with two different arms of research. So firstly, the NIH actually is an institution of research in its own right, and we call this intramural research. Essentially, we have around 6,000 scientists within the intramural research program, many of which are focused at the clinical center, and around 10% of the NIH budget goes to this kind of research. On the other hand, and the much bigger arm of our research endeavors is that the NIH supports institutions and people, and we call this extramural research. Under that arm, we support over 4,000 institutions and over 300,000 scientists and research personnel, and around 85% of the NIH budget goes to this. So you can see it's a significant portion of the NIH budget goes to this kind of research. Next slide, please. Okay, so what kind of research am I talking about here? The NIH mission statement is that the NIH is the steward of medical and behavioral research for the nation. Its mission is science in pursuit of fundamental knowledge about the nature and behavior of living systems, and the application of that knowledge to extend healthy life and reduce the burdens of illness and disability. So within that, we have a lot of different foci. We have biomedical and clinical research, of course, but we also have disease or diagnostic applications, as well as applied research foci. Next slide, please. To make sure we're covering all of the spaces within human health, the NIH is split out into 27 institutes and centers focused on different diseases as well as different systems. Overall, the budget for the NIH is around $42 billion. And of that budget, around $1.2 billion is focused specifically on commercialization, that is the SBIR and STTR programs. So around 3.2% goes to SBIR, and that's approximately $1 billion, and 0.45% goes to STTR, or $146 million, giving you a total of $1.2 billion for FY20. So now I'll pass it back off to Alana to talk about SBIR and STTR specifically within the NIH.
Thank you so much, Dr. Russell. So first I want to tell you about the overall program for small business funding at NIH. We are a seed funding program. So what that means is we provide the initial money that you need to get your company started with the research that it needs so that it can later on interest investor capital, venture capital, or angel researchers or angel investors into your company and get that further on funding. We understand that the funding that we provide through our program can't get you all the way there, but we're hoping it can be the seed to start growing your company. There's some special benefits of the funding from the NIH. One, it's non-dilutive capital. Two, your IP and your data rights are protected through this program, so you keep all of your own rights even if you contain our funding. We have several funding mechanisms at NIH. Generally, we're divided into a phase 1 and a phase 2 program. Our phase 1 program is generally capped at $252K. It's for 6 to 12 months, and we're really looking for proof of feasibility. Can you tell us by the end of your phase 1 that your technology has a high probability of success? Our phase 2 program is generally capped at 1.7 million total costs. It's for 2 years, and we're really hoping by the end of it, you can have a prototype developed. We do offer a fast track option. The fast track option means that you are simultaneously submitting both your phase 1 and your phase 2 applications, and they're both going to be reviewed by peer reviewers at the same time. If you are selected to receive a grant, you will receive funding for your phase 1. At the end of your phase 1, program staff and grant staff will review your milestones and make sure that you are on track. And as long as you have a successful completion of phase 1, then your fundings will be released for phase 2. So it's about a 2 to 3 month gap between the phase 1 and phase 2 funding. I do like to note that for our phase 2 applications, you are required to have a full commercialization plan. And that commercialization plan is weighed just as heavily, if not more so, than the research strategy. So it's very important if you're submitting a fast track, a phase 2 application, to make sure that you have a strong commercialization plan in your application. And finally, for our SBIR grants only, we offer direct to phase 2. That means that if you can show proof of feasibility, and we don't define what proof of feasibility is because we know that all technologies are very different and proof of feasibility can be very different depending on what you're working on. But if you feel that you can show proof of feasibility, you can put that into your phase 2 grant and you can supply directly to our phase 2 program just for SBIRs. There is follow-on funding available through NIH and a phase 2B program, but unfortunately NIBIB does not participate. That doesn't mean you can't start your grant at NIBIB, develop it to a specific point where it's more disease focused, and then submit a phase 2B to one of our other ICs. I'm going to go over our application process and review timeline for our SBIR program. First, I should state that all applications for our program, our small business program, are received electronically, and I'll talk about that a little more later, but everything's received online. When you submit your application, it first goes to DRR, the Division of Receipt and Referral, and they check your application to make sure it's filled out properly. If it's filled out properly, they accept the application, and then they assign it to an institute or center. Once they do that, then they pass your application on to the Center for Scientific Review. The Center for Scientific Review assigns the application to a peer review panel. You can check online through one of the portals you'll have to sign up for, which I'll discuss later, what peer review panel you've been assigned to and when your peer review panel is going to meet. About a month after your peer review panel meets, there'll be a written summary statement that's released. This also you get through your online portal. I always tell applicants it's a good idea once the summary statement's released to get in touch with the program officer that's been assigned to your application, because they can go over the summary statements with you and help you develop a plan forward for your application and tell you really what it means. In the small business program, we have 3 standard due dates a year. They are January 5th, September 5th, and April 5th. However, if one of these days falls on a weekend or federal holiday, then the dates are just simply pushed to the next business day. So our next application deadline coming up is actually September 7th, pushed to the next business day after September 5th. And then you can see on the graphic online what the timeline is for funding. Should you receive funding, should you be selected to receive funding on your first try? It is not uncommon, especially for new applicants to NIH, to have to resubmit their applications at least once before they submit funding, and that happens quite frequently. For our small business program, we do require that you are a small business. NIH defines a small business as a for-profit organization. That means you have to be registered as a business, either an LLC, a sole proprietorship, some type of business license. You have 500 or fewer employees, including any affiliate employees, and that you're a US owned and operated business. Additionally, most of the work that is done on our small business grants need to be done in the US. There are a few exceptions available, but mostly this program is designed to support US-based small businesses. As I mentioned previously, all our applications need to be submitted electronically. And NIH is a division of HHS, and therefore we require 5 electronic registrations. It can take up to 6 to 8 weeks for all these registrations to be approved. So please make sure you start early getting your registrations approved. We require the DUNS number, the System for Award Management SAM registration, Of course, your SBA.gov registration. We use ERA Commons, and then you have to submit your grants using Assist or grants.gov. The PA announcements, which I will tell you about later, include all of the information as to how to register for each of these systems online. And here's just a quick overview on the differences between our SBIR grants and our STTR grants. What I like to point out is that the main difference between these grants is who the PI is on the application. For SBIR grants, the PI has to work on their grants in the capacity of working for the small business. For the STTR grants, the PI can work in the capacity of a research partner. Most of the times this is a university, so they can work on the grant with their affiliation with the university. Which one is better to apply for is always a question I get. I like to answer it this way. We have more funding available in our SBIR grant program, but we have fewer applications for our STTR grant program. So what that really means is the method to pick is the method that will help you perform the best science possible. So if you have a PI on your grant application and that PI is integral to getting your science done and they work for the university, then please use our STTR mechanisms. That's what they're there for. If not, then of course you're welcome to apply to our SBIR mechanism. And finally, just a link at the bottom, this is the NIH SBIR website directly to our funding page. So this is always updated with our latest funding announcements, and I will go into exactly what funding announcements are currently open a little later in this presentation. But if you want to always check this page, it's always updated. So now I'm going to go give a brief overview on NIBIB and our small business program. So NIBIB mission is to improve health by leading the development and acceleration of applications for biomedical technologies. What this means is we fund the early stage engineering and design of new technologies for some sort of biomedical or clinical application. Unlike most of the other ICs at NIH, we are disease agnostic. What that means is that we accept technology, design and engineering of new types of technology for all types of diseases and conditions. It doesn't mean that your technology has to affect more than one type of disease or condition. In fact, the stronger applications are the ones that are put in that address a specific type of disease or indication. It helps show innovation and it helps show the biomedical need gap in your application, which is very important for peer review. A lot of times I get the questions, my platform would work for several different types of diseases. Which one should I put my application in for? And I tell the applicants that's really a business decision. So that's where you need to do your due diligence, reach out and do your interviews with the stakeholders, find out what the markets are like, and find out which is the best area for your business to break into with your new technology. I always love to show this slide. I stole this slide from the director of NIBIB, but it really shows how NIBIB fits into the NIH atmosphere. We help fund the early phase design and engineering of new technology that then can feed into any institute at NIH, any disease-specific type platform. And so now I'll turn it back over to Dr. Russell, who will talk about our specific portfolios at NIBIB and then the specific portfolio she runs.
Thanks, Alana. Yeah, so Alana set this up really, really nicely. I mean, NIBIB is really focused on making sure that we're the incubator for technologies that are going to spin out to the rest of the NIH. In order to address all of the different things that every IC might need, we really needed to be split up into 3 different scientific divisions. So firstly, we have the Division of Applied Science and Technology, or Bioimaging. And this is a portfolio really focused on clinical imaging overall, as well as sensing. So we have portfolios like bioelectromagnetic technologies, bioanalytical sensors, image-guided interventions, MRI, molecular probes and imaging agents, nuclear medicine, optical imaging and spectroscopy, ultrasound, as well as X-ray, electron, and ion beam. The next portfolio we have is the one that I'm here representing. It's the Division of Discovery Science and Technology, or Bioengineering. And we really focus on more the interventional side of things, the therapeutic aspect. And to do that, we're split up into 4 basic portfolios. We have biomaterial interfaces, biorobotic systems, mathematical modeling, simulation and analysis, and synthetic biological systems. And lastly, we have the division of health informatics. And that's really focused, as you might imagine, on informatic concerns. So they have artificial intelligence, machine learning, and deep learning, connected health, biomedical informatics, point of care technologies, including diagnostics, and image processing, visual perception, and display. Next slide, please. Okay, so as I said, I'm here representing the bioengineering division. So that's the division that we're highlighting today, and the portfolio that I work with and that I'll be highlighting in the next slide is part of this division. So the mission statement for the division overall is development and demonstration of modular platform technologies without preference for any disease or application that manipulate and interface with biology to enable new paradigms of clinical intervention for human health. So just like Alana said, we're really focused on doing this engineering of platform technologies that are for this biomedical intervention. They have to have this biomedical context. And so really to put the focus on the fact that we're trying to do this prototype development, we have our program split up into 3 basic design areas. So we have the program area of prototype design, and that's where mathematical modeling, simulation, and analysis falls. Next, we have prototype demonstration, which really is a catch-all term for all of the basic technologies that come in that are being developed. And those are split into biomaterial interfaces, biorobotic systems, and synthetic biological systems. And lastly, we have our program area for prototype deployment. And this is where, things that are generally later stage concerns tend to come in, but also where, we have these resource centers for bioengineering technologies, as well as this portfolio for small businesses for bioengineering technologies. So I'm really going to focus today on this biomaterial interfaces portfolio within the prototype demonstration cluster, because that's the portfolio that I represent and that I manage. Next slide, please. Okay, so specifically within the biomaterial interfaces umbrella are a couple of different portfolios that people may be used to seeing. We actually recently did this kind of reorganization. And so because of that, we still wanted to make sure to call out a specific portfolio within this, as opposed to just talking about the entire biomaterial interfaces portfolio as a whole, but I'll still kind of go over that to some extent. So the biochemical engineering portfolio is one that is one of the bigger portfolios that's under this umbrella. So the biomaterial interfaces portfolio in general is designed to engineer new prototype biomaterial interfaces to mediate human biology for clinical purposes. And so for those of you who might be familiar with how we used to be organized, this includes the biochemical engineering portfolio, as well as the portfolios known as biomechanical engineering, bioelectric engineering, biomagnetic engineering, bioacoustic engineering, and biophotonic engineering. And so essentially, all of those are still focused around this same idea of creating platform technologies for biomedical intervention, but they're split into these individual sub-portfolios based on the field of innovation of what you're making. So if we look just at biochemical engineering, since that's the one that we're highlighting today, there's a couple examples on the website of different overall themes or research themes that might fall under this umbrella. There's actually also, if you scroll down on our webpage, a list of all of the funded grants within this portfolio, so you can look through those and get an idea of if this is a good fit for you. But generally, we see examples like nanostructured metal oxide surfaces for implant infection mitigation, and things like engineered viruses, exosomes, and nanoparticles for therapeutic agent delivery. So you'll notice that the last part of both of those things is bold, this implant infection mitigation and this therapeutic agent delivery. And that's really to show, again, the fact that, the NIBIB is the engineering arm of the NIH, but we're still a key part of the NIH. We're still subject to that overall NIH mission of trying to advance human health. And so because of that, all of the technologies that we support have to be at a stage where they're ready to start looking at biomedical context. They need to have this proof of concept validation, at least, of some way in which they can show future clinical relevance. Next slide, please. So you can imagine that since we're focused on really a specific part of the tech development spectrum, where on the one hand, if you're earlier stage than this, you might go to the NSF. And on the other hand, if you're a later stage, then really building your platform technology, if you're now optimizing it towards something specific, you might go to a disease-specific institute or center. It's really important for us to evaluate mission fit, not only to make sure that you should be working with us, but also to make sure that you're taking advantage of all the opportunities available to you. If you have different arms of your research that should go to different institutes, you have other opportunities at those institutes that you should explore. So to make sure that you are in the right place, we really like to evaluate mission fit using these specific aims pages. And so for those of you who aren't familiar with a specific aims page, this is something that's going to end up being part of your application. And it's really just this one-page document with 4 paragraphs laying out what you want to do, why you want to do it, and how you want to do it. So usually our first paragraph is this opening paragraph. What is the biomedical clinical gap? Why does current technology not fill this gap? How can your technology fill this gap? And why is your technology innovative? So really setting the stage for this. What is the problem you're trying to address? What else exists in this space? And how is what you're building going to address those same engineering problems? Next, you can talk about who, what, and why. This is your long-term goal, your main objective, and your rationale. Really putting all of this not only in context of the clinical problem, as well as the context of your scope of research. Next, you can talk about your aims. So for each aim, you're going to have a title as well as supporting details. Usually people give around 2 to 3 aims, although that's not a hard and fast rule by any means. I've seen people come in with 1 aim. I've seen people come in with 4 or 5 aims. It's really dependent on the scope of your research, what you want to do within this time, and how you want to break that down. And your aim should really focus on design and engineering of new technology. Lastly, you really want to focus on your payoff, your expected outcomes and your impact. Really drive home why what you're doing is important. What is your overall goal? How does this impact the overall goal of advancing human health? So once you've kind of created your aims page, the next step is to email it to our SBIR inbox, which is nibib@mail.nih.gov. It's at the bottom of the slide. And we say that we would like that well in advance of the submission deadline. So this is for a lot of reasons. A lot of times it takes some time to review specific aims pages to make sure you're in the right place. Also, many times people will come in with a specific aims page that's not necessarily clear about where they are in the tech development spectrum. And when that happens, we like to have conversations with those PIs. And so because of that, we need enough time to make sure that we have time to hash it out amongst ourselves, to talk to you, to make sure that we can answer your questions, as well as to make sure that you're working with the right institute. And so well in advance of the submission deadline, usually we like to see 6 to 8 weeks, but really it's when you're ready. You can do earlier than that. Later than that, you might start to be pushing a little close to the deadline. So please try to make sure to get those things in ahead of the submission deadline. And now I'll hand it back off to Alana to talk about specific funding opportunity announcements.
Thank you, Louisa. So now, as promised, here are the slides that will tell you about our relevant funding opportunities. So what I want to make sure everyone understands is the majority of our funding goes to investigator-initiated applications. That means as long as you're a mission fit, you can apply for our program. So what we have are omnibus funding opportunities. They're divided into the Small Business Innovation Research, the SBIR funding, and the STTR funding. And then we have a PA for clinical trials or non-clinical trial applications. There are links to the PAs here, but you read the PAs, they will tell you exactly what you need to submit your application, how to sign up for all the online systems, and then they always have scientific contacts at the bottom if you have questions, and grants management contacts if you have questions when you're filling out your application. The other thing I want to bring your attention to is we also have an administrative supplement that's PA 18837, and that's to promote diversity. So what this is a supplement you can apply for after you have a funded grant, and it really supports the salary of a diversity candidate to work at your small business. And NIH has a notice out that states how we define diversity. You can find that in the PA. And the idea behind this is to get diverse candidates and a diverse working pool into small businesses, into entrepreneurships. This supplement does require that you send a personal statement for your candidate that states why they're interested in the small business aspect, that you have a mentoring plan in place to make sure that any people that are hired to your company with this supplement have the mentoring in place that it would take for them to succeed. Right now, we also have a couple of special announcements open. So one that we have right now is our notice EB 21001, and this is for specifically for small businesses for innovative technology for improving outcomes for maternal health. So what we're looking for in this nosy is that technology that can be used to diagnose maternal health during pregnancy and post-pregnancy. So do you have some sort of wearable technology that you can pivot to look at a biomarker that would help in maternal health? Um, do you have some sort of technology that can help with racial disparities, technology that can be used out in rural settings, portable technology, technology that a general practitioner can use in areas where it's really hard to find specialized OBGYN care? All of those things. If you have this type of technology, send us your specific aims page and we'll evaluate it. And then you just apply through a regular omnibus funding announcements. And then there's box 4B in one of the forms and you write down that you are applying under this nosy. Also, once you have funded grants at NIH, we offer a lot of additional innovative support. So through our seed office, we have regulatory and business development consultants that you can request to speak to once you have a funded grant. We also have additional support that you can apply for called technical and business assistance, TABA funding, once you have a grant. And this funding is really used for the non-research aspects of your grant. It's used to hire consultants for regulatory. It is used to hire marketing consultants. It is used reimbursement, management, all of those types of funding. On the screen, you can see that there are limits for the funding you can request depending on what phase of grant you're applying for. You can apply for this funding when you're submitting your grant application in your funding budget page, or you can apply for it as a supplement afterwards. I do like to tell people when they are requesting this funding to really write down what they're going to use it for, and if it's at all possible, which consultants they're going to ask. Because we really have to make sure the funding is being used for what it's appropriated for, and we look into those details before we okay that type of funding. We also have a TABA needs assessment program, so you can submit an application. It's open all year on a rolling basis, and we contract with an outside company that will review your technology and let you know where the niche market needs are, and give you different ideas for marketing and commercialization. And finally, NIBIB runs an entrepreneur training program. This is our Concept to Clinic Commercializing Innovation C3I program. And this is really designed for medical device innovators to understand what it takes to get a medical device from the lab to the market. The power of this program is that when you are accepted to it, you get assigned a business mentor and a project manager, and they work directly with you with your technology to understand your specific needs. And this tailored mentoring is really helpful for the program for you. You can find more information online. I will briefly state we have 3 different versions of this program. Our first version is called the EC3I program. It's an all online program and was designed to be all online before COVID. It runs about 10 weeks during the summer. It's really geared at academic investigators who want to learn how to translate their technology out to the market, and also for very new small startup businesses. We have a more in-depth program that starts at the end of August every year, and that's for 24 weeks, and that goes into more details for all of these different aspects. And then if you get through that program, then we can invite you to join our third part, our C3I Excel program, which actually gives you some supplement funding to do your killer experiments that's needed for investor capital. So just ways in which that you can stay in touch with us. We have a lot of different small business listservs. There are 3 Twitter handles on here for you to look at, but I know NIH has much more. And there's different websites that you can find. And finally, we always encourage you to contact us with any questions you may have. Here's my contact information, Louisa's contact information, and the SBIR, NIBIB SBIR mailbox information. All right. So once again, thank you all for being here. If you have any questions later on, feel free to email us. And we look forward to being in touch with you. Bye, everyone.
Thank you all so much.